To call the Human Service Committee meeting to order. Can I get a motion to approve the minutes from November 21st, 2023 that were already distributed to committee members? Can we get a motion to have them approved as recorded? Vinny, can I have a second?
Yes, second.
And everyone in favor, say aye.
Go ahead.
Anyone opposed, say nay. Okay. Motion carried. The first presentation for today is going to be by the county manager, Ryan Pache, and it's going to be about the proposed 2024-2025 goals for the Human Services Committee.
Thank you, Jessica. So we don't need to reiterate that since everybody just heard it. Like I said before, though, these goals are not in any particular order, and they are based on feedback from the legislators. So continue to expand childcare initiatives. That is Cassie Buell and Naturally Lewis. They're going to work on that. They do have a big grant, $3.8 million, I believe, that Cassie secured in order to expand childcare in schools. So Harrisville and South Lewis, we're going to have on-site childcare centers, which is definitely very good. And then there still are ongoing meetings regionally to leverage state childcare funding. If there is a legislator that's particularly interested in this and wants to be more involved, we can include them in some of those regional meetings as well. Support Public Health's Community Health Improvement Plan. This is a carryover from last year. This is something that the committee has expressed interest in tracking and being more supportive of. The Community Health Improvement Plan is designated by the state. We have to measure all kinds of different health indicators in our population, and then we have to develop strategies that target those indicators that are particularly out of step with the rest of the state health. For us, that would be obesity, diabetes are two big ones. Mental health and suicide are often big ones as well. So we've got initiatives for those, as well as I would say childhood obesity is another big one that we want to focus on. So Public Health has a series of programs that they'll be implementing aimed specifically at improving those KPIs for our community health population. Continue to discuss recreation patrol. This would be under the sheriff's office with Sheriff Carpinelli. I think everybody shares the same goal to ensure that our trail system and recreational assets are as safe as possible. What does that look like? How is patrol distributed? We've got some large events that we need to continue to think about the public safety for, SNRT being one of them. So this remains on our radar and something that the legislators have indicated they want to continue to discuss. Review jail medical contracts. This is something that the sheriff and I came up with. So Jefferson County last year went to a single source jail medical service. It's a one contract that covers basically all medical services in the jail. Right now, we probably have 4 to 5 medical contracts that overlap in different ways to cover the health of our inmates. The most recent state mandate of the medication-assisted treatment has really, shown how expensive this overlapping system of care is and how complicated it is. We may consider, it's something that we want the legislators to help us suss out if, bidding out for a single source contract is the right thing to do. And if it is, would it be appropriate here in Lewis County? I'll tell you, it might not be cheaper, but it would be a lot simpler and probably eliminate some of the loopholes that are in the care right now. So something to think about. Support employee wellness initiatives. This would be led by Caitlin Smith and our employee wellness committee. We need to talk and prioritize a lot more about wellness because our insurance costs continue to go up. We are self-insured, and so the health of our employees is directly related to the health of the plan. And I think our employees and the administration and the legislators, nobody wants to continue to see our health insurance costs go up. And the best way in the long run to really curb health insurance costs is for our employees to live a healthy lifestyle, physically and mentally. So we want to double down on those initiatives, and really we need to put more money and focus on those types of things for our employees. And so develop some creative solutions to try to improve the health and wellness of our employees. Complete Lewis County Health System renovation project. This is probably the most important thing that this committee will be focused on. Legislator Nortz, as our representative of the Board of Managers, Jerry Kayer, and the whole Board of Managers is going to be responsible for that. We still have to complete the second bank of patient rooms and convert the old operating suite, which is on deck next. We also want to close out the project with engineers and contractors, and then have that last ribbon cutting ceremony. So making sure that Lewis County Health System continues to get in front of this committee and report on their ongoing efforts, I think is going to be important. Reopen maternity services. This is obviously another important one that is of value, of consequence to the community. There's been a lot of talk about maternity services. Again, same crew for the previous goal. We need to support Lewis County Health System's efforts to restore women's health services and track the expenditures and efficiency of maternity services to ensure long-term sustainability. We talked a lot about that last year. The long-term sustainability of maternity, we need to continue to track that, and we need legislative leadership on that going forward. So those are the goals that we put together for Human Services Committee. Unless there are additions, subtractions, or discussion, we're happy to entertain any of that.
Ryan, on the review of the jail medical contracts and options, is there anything possibility of a shared service with Jefferson County on that?
That is what I am hoping. I think if we were to bid this out just as Little Lewis County, we probably would not be able to attract a firm that would want to come set up shop just here in Lewis County. But considering that Jefferson County has found someone, I could see us basically being like a satellite from their jail in that sense. So I think that really makes this opportunity more likely than it would have been in the past.
Right. Thank you.
Mm-hmm.
Any other discussion? Okay, so we'll move on to the draft resolution, of which we have one. Cassandra?
Thank you. Authorizing agreements between Department of Social Services and New York State Office of Children and Family Services and with Community Action Planning Council of Jefferson County for the purpose of receiving federal funding in the amount of $42,270 from New York State OCFS and for conducting registration and inspection of family daycare and school-aged child care providers for Community Action Planning Council of Jefferson County at an annual cost not to exceed $40,157.
Any discussion? Ryan, just for clarification, this is money we receive. We get to keep a little bit of it and then spend. We just basically disperse most of it back out for this purpose.
Yes, I believe so. Hold on. Yes, correct. Yep, sorry.
You're fine. All those in favor say aye.
Aye.
All those opposed say nay. Carried. We do have one motion to review. I am going to move that the Human Services Committee approve the proposed 2024-2025 Human Services Committee goals and forward them to the full board for adoption. Do I have a second? Josh, all those in favor, say aye. All those opposed, say nay. And motion carried. Yeah. See, it's
Ms. Mosher, we do have a request for an executive session for a personnel matter involving the hospital CEO. They're expected here any minute now, so I would suggest and request that we just take a little recess.
so we'll go and recess until they get here.